as we think it will. But Lois and I want to have a conversation. We've been doing National Physicians Suicide Awareness Day for a couple years on this platform, but overall, this has been a journey through a large part of the last 10 years of our lives, if not more. And we want to talk a little bit about where we have come from, where we are, and where we have to go. And a large part of this conversation is going to have to acknowledge the fact that in the last 2 years, COVID has been a reality. And the stressors on healthcare workers have been so high. And it's a discussion that we're going to have in this context. So starting out, Lois, why don't you share a little bit with us about how far we've made it? Where did we start and how did we get where we are here today?
It is an amazing journey, and thank you for giving me the opportunity to talk about it. I've had the opportunity over the last 4 years to talk with other people and share some of my stories, but this is actually the first time that I get questions asked to me too. So how this all started was, I believe it was a February phone call that 5 of us were on to talk about the Cord Mental Health Task Force. And one of the people, Dr. Dan Lakoff, said, we should do something for National Physician Suicide Prevention Day. And I said, I don't think there is one of those. He's like, oh, I'm like, but we could make one. So this little group of 5 people came together and chose a date. Of course, it was September because September is Suicide Prevention Month. And we had to decide, like, can't be September 11th. We don't want to hit the Jewish holidays if possible. We want to stay away from Labor Day. And then we decided we needed a logo. And that was one of the best things we ever did because that got the word out. And over the last 4 years, I have found that I've been able to connect with people. And today we had Dr. Sally Spencer Thomas on talking about workplace suicide. We had talked about emotional PPE, talked about self help for suicide, and all of these little things I think grew out from those connections that developed to the point where we are now, having another set of interviews archived in the American Association of Suicidology Facebook.
Yeah, I think it's really amazing where this started off as singular people in different parts of the country noticing something that was needed. And maybe it's the power of the internet, maybe it was the right time, maybe it was the social setting, maybe it was where the country was overall. But somehow everybody, and it feels like around the same time, started to get connected. And it really was about 4 or 5 years ago, probably around 2015, 2016, where suddenly everyone starts to get introduced to everybody else. And we all start making this connection. We start realizing, hey, I'm not the only person doing this. And it grows and it becomes this thing that just gains more and more and more and more momentum. And it's so nice when you see these tiny little ideas that pop up that suddenly show up at another institution, show up at another hospital, or someone else comes to you and says, oh, have you heard about this? And you get this tremendous sense of pride because even though I had absolutely nothing to do with the creation of it, it's so nice to know that these ideas are still percolating through the community.
Absolutely. One of the biggest joys is when something comes back to me like a tweet and I had nothing to do with it. Like, I don't even know who you people are. And that it's gotten a life of its own. It doesn't rely on any one person to keep it going. I think that's been the true joy of seeing this happen.
Yeah, and it's been so lucky that we have this network set up and we have this connection between all of us across the country when COVID really started. Because I think it was something that, I never thought in my career anything like that would ever occur. It was always something like, oh, yeah, I guess it's possible there can be like an epidemic or a pandemic. And realistically, I was more worried about Ebola coming to the United States than I would have been about a respiratory virus spreading, but it completely changed the face of delivery of care in the United States today.
Absolutely. You're right. In 2014, when two interns went off buildings in New York City in August, that really galvanized people. Um, Social media had picked it up. It had become a time that the ACGME became very interested in physician suicide and resident suicide, did some research on that. And so the timing was right. And I think for us in emergency medicine in that group, I think individuals had some ideas, but when we banded together, that strength of bouncing ideas off each other, it seemed an easier lift if all of us were doing it together than one person trying to create it. Um, and then when COVID hit, I consider COVID this mass casualty emotional hit that it opened the door to talk about mental health and burnout and moral injury because we were all suffering from it. So it opened the conversation. Unfortunately, it also has caused us to be isolated. And I think that is going to be really hard to overcome.
Yeah, I remember that phone call. You called my cell phone. That one day you were leaving that conference in New York, at the very beginning of COVID when the cases were starting to rise in New York. And at that point, our conversations prior to that had been, this sounds bad. Maybe something's going on. And you were the first person to really tell me this is really bad. Our world is changing and things are never going to be the same again, at least in the near future. And almost immediately after that phone call with you, I started having conversation after conversation locally and nationally with other people about how do we protect physicians as a group? How do we ensure that they're okay? And it was such a beautiful thing to see things like, the physician helpline really start to pop up and what Mona Masood did and these grassroots efforts start to really grow on their own. But that conversation you had with me in my mind marks that moment in time where the world really actually did change.
Yeah, that conference was a very interesting conference because it was in New York from the 7th to 11th of March. And I'm a catastrophizer. I will say one of my cognitive distortions is being a catastrophizer. But I had been watching this and I thought two things. One is that I thought that there was a very real possibility that I was going to die from this. I wasn't low risk. And um, that looking back through pandemics, we were due for 100-year pandemic. That's the way the world works. And having my resolve that I'm going to work this because that's what we do. The other thing is I remember telling somebody when they said, how many people do you think are going to die from this? And I said, millions. And I don't think that is something that people really said before, to really realize that level of impact. Um, it is huge. And we do need to develop programs to protect ourselves. I think that that's one of the things that we're really seeing in that tragedy of all the changes, people stepping up, like the physician support line, like emotional PPE, that taking better care of ourselves is taking priority.
Mhm. I was so proud of our community in the kind of social media circles. You and I both run in kind of similar circles and also different circles, where whether it was on Twitter or on Facebook or on any other various forms of social media, um, people started sharing things and people started saying, like, hey, things are bad in New York. Is everybody in New York okay? Or, hey, I have a friend that's working in New York that's really struggling right now. Is there someone that I can connect them with help? And the responses that you would see from our community were just enormous. Someone would post something, on Facebook or, tweet it, and suddenly you would get hundreds of responses from people all around the country supporting them and wanting to help them out and getting them to resources or, just helping them through a really tough day. Um, there was that side, but then there's this other side that, really saddened me. It was is this really how our industry supports each other? That we don't have those safety nets in place, that someone can't look locally. They can't just reach out to their employer and get that help, that they're posting anonymously on a social media website to ask somebody to help them.
Yeah, I hear you with that. One of the things that we haven't told people, physicians, people that are becoming physicians in the past, is that this is a rough road. And there's been that sort of individual rough roads that people have, and you go through it alone. Um, and so we haven't developed those resources. Everybody's sort of doing it on their own. Now with COVID, everybody is on a rough road. I think we are seeing the beginnings of some of those resources, and the workplace suicide prevention, awareness, leadership talking about it, things being put in place.
Yeah, that has been one of the silver linings of this epidemic that's occurred is so many hospital systems are taking this so seriously now and really trying to make very real interventions and trying to step in and say, what can we do to support our staff? And it is very refreshing to see that. Prior to that, I'm so used to people fighting such an uphill battle just to be heard at a corporate level that, now people are reaching out and saying, what can we do to help you?
Yeah. And I talk about my population because that's what I am. I'm a physician. But if we look at healthcare, what is happening, and we're talking about suicide and suicidal ideation here, but those distressed feelings, whether that's moral injury, burnout, the negative impact of what's going on right now to healthcare workers, to nurses, a resource that we cannot easily replace is our people and how we take care of ourselves and our colleagues that are right beside us. Whether that's, I work in emergency medicine, so it's a team sport. The nurses that are there, the paramedics that are bringing people in, these are all high risk groups. And if we don't protect this really most valuable resource that takes a long time to generate new ones, we are going to be in serious trouble.
And we are so lucky. We are incredibly privileged that we are a limited resource in hospital systems. And from a financial standpoint, we are very important. So we are taken care of in a hospital system. But not everybody else that we work with on a daily basis is. You know, our respiratory therapists, our nursing staff, the staff that I see, today when I was rounding on my COVID patients who are going in and out of that room way more than I'm in that room, completely gowned up, don't always have the same political leverage that I do. I was on the elevator the other day talking to somebody who I've known forever. I've worked in the same hospital for 5 years, and I've known him for 5 years. He works in our environmental services, and he cleans a lot of our ORs as well as hospital rooms. And I was asking him how things were going in terms of staffing because we had a large amount of attrition within our system when COVID started to hit, and there were safety concerns. And he was telling me it's really hard to hire people because you can make more money working in an Amazon warehouse and you don't get exposed to COVID every single day. And that conversation in that elevator really hit me because, you know, I'm it's easy for me in my position to not always notice the privilege that I have and the advantages that I have, and that sometimes people go out of their way to assist me in something. And to have somebody else that I work very closely with, that I depend on, ensuring that our hospital rooms are clean and turned around quickly. So my patient sitting in the emergency room doesn't stay down there too long, can get up to the ICU bed, is telling me that people that he works with are very worried about their health and that financially they can make the same amount of money in something that's not as dangerous. And as I was leaving that elevator, he mentions to me that part of the reason he does that is because he gets to help people every day. And you forget about all these other people that make up that care team and all these other people that influence the experience that our patients have in the hospital every day, and how important it is that we watch out for them as well.
Oh, yeah, absolutely. And it is critical for the running of a hospital, to have rooms clean. And sometimes those are COVID rooms. And those people that are going in, to clean the ICU rooms are taking that risk. I think we have to recognize how important that is to our healthcare system. I appreciate you saying that.
Yeah. Um, the last thing I think we definitely need to discuss is what the future looks like. And I will say, if we had this conversation 2 years ago, I think we'd be talking about very different things than we're talking about today. I think COVID has completely changed the healthcare landscape. Some things for the better, some things maybe not for the better, but the reality is where we are today. What do you think are the big things going forward that we really need to continue to target and continue to push?
Um, I think this conversation is different because the landscape is different, but I think we still have some of the same things. And there has been this balance, sometimes animosity between sort of individual and systemic things. And I still think we have that dichotomy. Um, the easiest thing to change and work with is ourselves. And having those resilience skills, making the connections, having meaning, finding hope, having gratitude. Those are things that we can do, having enough sleep. These are things that we can do to help protect ourselves. Um, but I do think we also have to look at those systemic changes that have to be made, whether that is the resources being put in place. More importantly, what our leadership is talking about to break down stigma, to change the culture where we're able to address things of depression, moral injury, suicidal ideation, people that feel that it is a toxic workplace right now just because of all the stresses. I think we do have to have both of those. So where are we going in the future? I think on the individual side, sharing those stories of hope and recovery. We talked about this this morning. That is where a true difference can be made. We have opened the door to talk more about suicide and people who have died by suicide, but the strength is those stories of hope and recovery. And if we can change culture where you can show that people have gotten through tough stuff, I think that would make a true difference. And then I think we have to put in programs that make it sustainable for the PTSD, the repetitive trauma that we're having through COVID. So it's ability for physicians to be physicians down the road, and nurses, and environmental people, and dietary that are in and out of the rooms. All of us.
Yeah. I think our conversation with Dan Sadawi Kofka was very telling in the way he phrased his JAMA article, which is, it's refreshing to know that we've made a change, that things are better. But it's also important to recognize that we still have a long way to go. And I think right now we are partway down the road of this journey. And, we still have a ways to go, but I like how far we've made it and how quickly we've made it and how many people are helping us along this journey, that I am hopeful that when we have this conversation, hopefully not in 5 years from now, but sooner, that we can continue to reflect on how much more has changed.
Yes, there, and you bring up points of other things systemically. Um, there is the whole advocacy piece and the legislation, the Lorna Breen Act, Heroes Act that is currently being looked at. There is the credentialing and licensure issues that people are working at. There is so many people working on so many different facets now. I just have to think the momentum will increase. It may not be 5 years that we'll have all this figured out in credentialing and licensure, but the discussions are there. And state by state, there's changes being made. Just recently, I believe about a week ago, um, Minnesota has changed their language, and it's happening so frequently that our literature that takes so long to get into print is now outdated. So that the wonderful JAMA article that Dan was instrumental in, now with this change in Minnesota, in Florida also changed. They approved the language, but it didn't change till April. Also missed that publishing deadline. So what is out there, which is great that we have more information, has even changed since then.
Yeah, and it's so nice to have allies that drive that change forward. In the state of Ohio, one of the things that I've been working on, kind of off and on for the last few years, is that right now in the state, initial applications to become physicians are part of the Freedom of Information, which on the surface makes a lot of sense. We are healthcare workers in the state. It's a state body that is helping ensure safety among practicing physicians, but some of those questions of, do you have, any disease that would inhibit your ability to practice safely? If you were to mark no on that, that's publicly available to someone looking at it. So now there's movement within our state and at the legislative level about how do we ensure that there is openness and the ability to find information, but that we also protect the confidentiality of those individual physicians that are filling out the application. So there is not that additional barrier and that fear of, well, I guess my patient could just fill out some paperwork at the state level and they can see my licensure application. And they may not be able to see the comments I write, but they can see if I mark no to a box.
Mhm. Yeah. And I do think that that confidentiality issue is big because it's not just your licensure. It can be other things that people look at, from divorce to malpractice, ways that that information um, can be used against a physician, or that they worry about it. And that worry is real. If they're fearful that there can be some consequences and they don't have any ability to affect that, it's going to change whether they mark the box yes or no.
Yeah, that's so true.
We need to
Well,
have transparency of the consequences and process. If you don't know what checking that box means, there's going to be fear. And
mhm.
some of that transparency, if you're going to ask the question, we don't have statistics on, are all those people having to go through the board? Is it some kind of tribunal type of thing? Will your license be taken away or limited until investigations are happening? Will you have to pay for your own evaluation? And could this devastate you financially? I think that that lack of transparency of process and consequence is a huge detriment for physicians to feel comfortable.
Yeah, I agree. And I think, I'm not envious of their job because, anyone can go onto social media or search Google, and there are stories about physicians in which there were concerns that the medical board should have acted earlier and been more decisive in their action. And they're trying to balance that with also at the same time creating an environment in which making healthy physicians is possible, because ultimately doctors are people too. And as people, we go through tough times, and we go through times where sometimes we do need a little bit of help. And it is a sad place to be if you work in an industry in which you practice helping others, but you yourself cannot seek help.
It is. And that is a good statement to look forward in our future. How we were going to change things is having physicians feel like they can seek help and continue on the career that they want.
Mhm. And I think the one thing I'm looking forward to the most is seeing young physicians who are about to be graduating medical school and residency joining our ranks. Because that always happens every single year. You have someone who's just starting out that wants to make a difference and starts to reach out. And it's always such great, innovative new ideas, things where, you and I were talking about in some of the plans, when we're talking about safety planning. Yeah, I shared with you that as the first time I heard that idea, I was absolutely blown away. I was like, this is so logical. This is such an amazing idea. How is it that nobody's thought of this before? And I am sure there's dozen more of those that we just haven't really, thought about it. It hasn't clicked. And it'll take somebody else new coming in to say, well, why don't we try this instead?
Well, in talking about new, I think we have reached other communities. And I see in the comments on Help the Helpers this past Tuesday, NAMI, National Alliance for Mental Illness, had their first discussion on physician suicide. We have not been a population that has really been addressed before because people send suicidal patients, clients to physicians. We have the access, we have the money, we should have the knowledge. And it's not necessarily readily apparent to understand why it's been so difficult. So having these conversations and having these conversations with partners about helping the helpers, I think is really, really important.
Yeah, because we are at times a very insular community, and we don't always seek out help from everyone else, which is, I always find such a foolish thing that we do. We always try to reinvent the wheel and do it ourselves when we can learn from everybody else out in the community, other industries, other groups, and what they've done to be successful. So I think it's so important that rather than responding the way some doctors do when they're suffering from mental illness or medical issues or depression, whatever that is, instead of hiding it, we should shine a light on it. We should make it known so other people in other industries can reach out to us. Other people in other groups can reach out to us and give us ideas. So we have a place to start.
And that's why I love this being on the American Association of Suicidology platform. It is that bridge between the suicide prevention community and the medical community, making a difference, not only for us, but as we learn more about suicidal ideation and suicidal prevention, that we will be able to make a difference for our patients.
Yes, some of the biggest differences I've been able to make at a community level has been from my friends essentially at this point in the suicide prevention community that are in central Ohio. It's these connections I have and people who have absolutely nothing to do with healthcare at all, but care about suicide prevention and my relationships with them and the resources that we share with each other that we're able to make the differences we can at the local level of where I work in the community I work in.
Absolutely. You're doing a great job, Perry. I am impressed with all you do.
Too. Well, this was a great conversation. Hopefully, this becomes a normal thing and we can do more of these catch ups on Facebook Live events and on YouTube going forward through AAS.
And I love that. We were talking about the future and maybe have some open conversations where people can join in the future. If this is a type of format that people like, the comments will be open when we go to the archived format. Certainly put in some comments, and that might be a future offering that we have.